We're here for several reasons. To mourn with families and communities whose loved ones were lost to overdose, to recognize and celebrate survivors who are still with us today and the people responsible for saving their lives.
The Jeffco Board of County Commissioners is deeply committed to directing life-saving resources to those on the front lines addressing substance use and overdose, from public safety to human services and beyond. Being saved by naloxone doesn't always stop a person from using again, but it can and often does serve as a catalyst for change.
But really the important thing from a law enforcement perspective is that we have to break down the silos. This is an issue that requires a lot of cooperation, not just amongst law enforcement. And we partnered with our local health department, the Jefferson County Health Department, who are just phenomenal. It's a phenomenal organization. But we began carrying naloxone after working with them. We started carrying that in 2016. Since that time, we have utilized naloxone 21 times, and we've had 19 individuals that we've saved their life. So that's really something that we take a lot of pride in.
Our perspective, as those of you who know us, we really have a lot of faith in the behavioral side of this, because the life conditions that lead to addiction are becoming better known and hopefully better treated.
People with lived experience can help in ways that no one else can. You know, it's an education that you can't recommend and you can't buy. And so to address this crisis, we have to empower people to not only recover, but to use that lived experience and to be given some agency and some control over the direction of the programs we're a part of.
And the one piece that I would highlight is the language around the need for our youth to have opportunities for pro-social involvement with trusted adults and with youth that are engaged in pro-social events.
So according to SAMHSA Tip 42 from 2012, they identified that 50% of people with substance use disorders, or actually 50% of people with anxiety and mood disorders, also have substance use disorders. And the reverse is also true. So it just makes sense for us as the sort of largest mental health provider we're in Jefferson, Clear Creek, and Gilpin counties. So it makes sense for us to really do that integrated treatment. So we've really been increasing our substance use disorder treatment services for the past several years, especially since Medicaid allowed us to start billing for substance use disorder services.
The part of this fixture that me and my department represent are a holistic wellness, which is what we are focused on is resource acquisition, and that means anything. The big ones are housing, stable housing, food acquisition, but it goes beyond that really, which is it's just empowering people to get what they need in life.